Hey guys, I hope you are doing well today. Okay, let me do the sharing real quick and we are going to get started for today. My phone sucks. I got an Android and I've been team Android for a while now. And I'm about this close to about to get an iPhone because I'm telling you, like I need better
Hey guys.
oops. I need better quality in my pictures and video in my content basically, and I just feel like the iPhone will deliver that, but I just not the one button type of person. Okay, so I might have somebody train me on that because I have no idea what I'm doing with the iPhone. I wouldn't even know where to start. Okay, I'm still sharing, just give me a moment. So how have y'all been doing today, beauty professionals? Y'all been doing all right? Today, Friday, we made it to Friday, so that is a good thing. We made it to Friday. You know, how was business? Did business go well? Um, how are y'all doing? You know, with COVID still around, I know it's been some big changes on businesses and everything like that. I know definitely for me, it changed how I do business. So I'm sure it changed how you do business as well. And I'm hoping that business is going well for you all. Okay. So I'm gonna go ahead and get started, guys. So today, I want to talk about identifying, treating, and restoring hair loss. Like, and for these is basically for the professionals. If you are a beauty professional, like I've been a licensed cosmetologist 14 years before I became educated with the knowledge of trichology, before I started diving in trichology. I didn't even know it existed. I did not even know what trichology was. All I knew is I'm a cosmetologist. I specialize in healthy hair. If your hair break off, I get it to grow back. I had this thing what they call growing hands. Okay. Not a title that I made up. Other people said that for me. But with that being said, all I wanted was my clients' hair integrity to be on top. I wanted their hair to grow. I wanted to flourish. I wanted to make sure whatever style that I am doing, that it is not detrimental to their hair at all. So any style that I'm doing, it would not break it, dry it out, or none of that. So that was my goal as a cosmetologist. Then I had a little hiccup in my career. About 2 years back, 2 years back, I had a client who actually had alopecia. She actually had alopecia areata. At the time, I didn't know what it was. I just knew, oh, that's alopecia. And at that time, with my cosmetology education, all I knew, I didn't even know there were different types of alopecia or a category to alopecia. I just thought if it's bald like a baby, it's just alopecia. So at that, during that time, so I'm like, okay, well, the hair came out, and in my mind, I was taught that, okay, so if her hair came out, it must have been dry. Anything dries breaks. So that was my motto. Anything dry breaks. So that patch must have been dry for it to fall out. Okay. So what I did was I did like moisturizing treatment, anything to retain moisture to this client. Boom. I think I saw her about 2 weeks later. The spot got bigger. So I'm just getting nervous, panicking, and everything like that. So at that point, she knew and I knew that the next step is out of my hands. It's nothing I can do. I'm not equipped to help you. So I had to move her to a dermatologist. So she went to a dermatologist. Unfortunately, I lost the client. She never came back. But I gained so much more because from there, I wanted to know, how can I help my clients restore their hair? Started doing research and everything like that. Stumble across a couple of professionals that was on my social media platform, that was this word called trichologist. And I'm like, what is that? So I'm following them, loving what they're talking about. Oh, this is net season. Sorry, I'm just going like that because it's like a net just bothering me. Sorry. Okay, so I'm loving what they're talking about, and like, okay, they're restoring hair, people losing hair, they're growing it back, and once I got into trichology, I found out it was so much more than just hair. When you enter trichology, it's the whole body. Your hair grows from the whole body. It grows out of the head. I mean, out of your scalp, which is attached to your whole body. So don't think what you do to your body won't affect your hair. So, when it comes to alopecia, there's two types of categories you can fall under. You can fall under scarring, or you can fall under non-scarring. So, of course, scarring, it is what it sounds like. It's scarred, and most cases the hair can never be restored. Then you got non-scarring. With treatments and things like that, the hair can be restored. But when you dealing with types of alopecia, you do not want to prolong treatment, because the longer you take to get treatment, you doing a disservice to your hair in restoration. All right, so I'm not gonna tell you all the types of alopecia. I'm just gonna mention a few that's most common. Okay, so most common alopecias is alopecia areata, and that's one of the alopecias that my former client had. And at that time, like I said, I didn't have the knowledge. I wasn't equipped to help her, so I didn't know what it was. So now I know what it is, and I would know how to treat it, if she would decide to come to the clinic. And yeah, I'm even going to dive into that because that's for my class. All right. The next one is that's most common is telogen effluvium. You will see this when you're stressed, anxiety, mineral deficient, um, malnutrition. Telogen effluvium is basically your hair just coming out and just coming out. So you will see this, and it's kind of common because we live in a stressful environment. So why wouldn't your hair come out? you know you're when you stress, you release these hormones in your body that what's the word I want to use, it prematurely pushes the hair cycle into the resting phase, which that's the shedding phase. So that's when you'll see that. Then we got anagen effluvium, which is the growing cycle, and we see this a lot because a lot of people are dealing with different type of ailments to the body. They battling cancer, so with the cancer they taking chemo um causes the hair to fall out in the anagen phase. Um, CCCA. CCCA is centrofungal cicatricial alopecia, and that's basically like hair loss in the center of the head. it is most likely to be seen in the African American community. One reason is because we actually have a predisposition gene that is already set for us to get this. But not saying because you have this gene you're going to get it, but there are things that are a catalyst to this. So, and the last one that I want to speak about is androgenetic alopecia. So the name is kind of in there, genetic, androgenetic. So of course this is like the type of hair loss that's genetic or whatever. And just because you're dealing with um alopecia that's genetic doesn't mean that you have to fall victim to that. There are things that you can do with it, so you won't have to fall in the footprints of your mom, your dad, your sister, brother, cousin, or whatever the case. Um, what else I'm trying to talk about your hair? All right, so one thing that a lot of people may not know is your health plays a big part when it comes to hair growth, hair restoration, hair loss. So you want to make sure that you're taking care of your body. You're taking care of your body. And everything is done within balance. So too much of anything can be abusive and cause detriment to your hair and your body, and too less of anything can do the same thing. So you want to make sure that you're balanced. And I said all this to say, if you are a professional and you want to know about like how can I identify hair loss when it comes to my clients, how can I know like where they deficient in, if you want to know what type of vitamins they need so they won't be having hair loss, if they malnutrition, you want to know the origin of their hair loss, because you have to know the origin of it in order to treat it. You're not going to treat a fever with Pepto-Bismol. You know what I'm saying? You're not going to treat a flu, with nasal spray. So you got to figure out the origin of the hair loss. So a treatment program can be in place so you can treat them and it can be reversed and it can be restored. So I thank you all for watching. And if you are watching on a replay, thank you for watching. This is your girl, Letitia B. Fikes. And until next time, you stay educated. And if you're going to take our master class, click the link above. Stay educated, guys.